Here with Mr. Dean Cope today, a physical therapist at Heritage Living Center in Conway, Arkansas, and he's going to let me in on a little bit about what he does.
I'll try to stay listening.
Okay, where is it exactly that you work?
Heritage Living Center. It's a long-term care facility, basically a nursing home. We do subacute rehab, neuro patients, ortho patients, a lot of dementia patients.
Okay. And why did you choose this profession?
I wanted job security for one, and after kind of seeing what all was out there, it just seemed more fulfilling than some of the other ones.
And how long have you been doing it?
Since '96, so this is my 20th year.
And what advice would you give someone pursuing this profession?
That's a good question. Well, just make sure you pick which field that you really want to. There's a lot of different areas you can get into, and just make sure you get into the one you want to get into. It actually took me a few tries to get into one I really wanted.
Okay. What qualities do you believe someone in your profession should have?
Well, the ability to make decisions on the go, because a lot of times treatment approaches have to change fairly rapidly, or sometimes whatever you think was going to work initially doesn't work at all, and you have to change it, sometimes kind of on the fly. So,
what do you like most about what you do, and then what do you like the least about what you do?
The most would be when people get better, they're able to go back home and resume their daily activities. Least favorite is when you have to tell them they're not going to be able to do that anymore. They may need to consider long-term care or 24-hour care or something like that. But
it kind of take it negatively, I guess.
Well, sometimes they know that's the case, and sometimes they may know, but they can't accept it. Yeah, but having to break that to them is the hardest by far.
Okay. Do you hold any certifications?
I don't have any.
No certifications.
Other than.
And do you have to renew? Do you have a license you have to renew?
Yeah, annually you have to renew annually, but every other year you have to turn in 20 hours of continuing education hours. So.
Renew, is that what? I guess what license is that?
Yeah, you have to every March. You have to. Well, actually,
PT license.
Yeah, PT license.
Yes. What kind of patients do you see?
We see neurologic. Well, mostly in my setting, it's usually geriatric, but occasionally we get someone who's on disability and qualifies for Medicare, and we'll see them. We're seeing people younger than me. So I'm not that young anymore. But we see neurologic, like stroke or head injury, orthopedic, like joint replacements, fractured hips or legs, ankles. Pretty good variety, actually.
All right. How important is understanding technology in what you do? Do y'all use computer programs for
Oh, yeah.
stuff?
Pretty much every place. I do a lot of work on this after my regular job. And everywhere you go is going to be computerized documentation, pretty much. I mean, that's about the extent of technology, other than knowing how to run machines like ultrasound, diathermy, or anything like that. That just goes with your training.
Yeah.
And the computer programs change fairly frequently, too, because whatever company you work for decides some other program is better and it does what they want, so they'll switch programs. We probably use, just in the building I'm in alone, maybe 4 or 5 different programs.
Oh, really?
And they're all similar. You just have to figure out where to find what you need in there.
Okay. What was your journey to this point? Did you work somewhere before here? Or work your way up the scale?
I started working at Baptist doing acute care, just bedside. And that was kind of my plan out of school. I wanted to see as much as I could like in a short amount of time. And somewhere like that, you can see stuff that you may never see again once you leave there. But I worked there maybe, I guess, a little less than a year, and at the time they weren't one of the higher paying jobs, and I was having trouble getting on my student loan paid and all that. So I went to Russellville as a floater and got to do outpatient, inpatient, subacute, acute rehab, and a court unit, which I don't know if they even have those anymore, but got to do a wide variety there. And then while I was doing long-term care with them, I realized that I liked that, and I got a job closer to home doing strictly long-term care.
Okay.
And that was 18 years ago, probably.
18. Okay. Last question is: do you plan on keeping this job, or do you plan on, like, people get older, they'll find something that's not as strenuous or not as after hours or hour-wise?
I plan on staying there. I plan on doing the same thing until I can. And who knows when that'll be.
Yeah.
The older I get, the better my transfer techniques and all that gets, because out of necessity.
Yeah. All right. Well, that's all the questions I have.
All right.
So,